Hi friends, welcome to the channel The Nurse. Here we are discussing about some nursing basic questions and answers. If you are not subscribed to our channel, please subscribe. And one more information, we have started one new model test series for Navodaya Vidyalaya Samiti female staff nurse exams. So if you applied for that exams, you can try. You need to download our Android applications, that is the Nurse Academy from Play Store, and you can purchase the model test series of Navodaya Vidyalaya Samiti female exam series. We have initially we are planning to include 10 test series. If time is there means we will add more test series. So the test series included the same exam pattern syllabus, that is nursing questions 70 nursing questions, general awareness questions, reasoning questions, and general English and Hindi questions. So the same syllabus patterns we have made for model test series. So best wishes. So we will go to our topic, that is basic nursing questions and answers. Nursing basic questions and answers. First question: while doing colostomy irrigation, the height of the irrigation bag should be around. While doing colostomy irrigation, the height of the irrigation bag should be around. So here I have demonstrated with the picture, that is this is a colostomy irrigation procedure. So this height of the colostomy bag should be 18 inches, 24 inches, 12 inches, 36 inches. Correct answer here, 18 inches. The height of the colostomy, the ideal height of the colostomy bag is 18 inches or 45 centimeter. And some other examples also is same height will be there. For that, we have used to give this enema with enema can, that traditional style enema we are giving through the enema can or enema bag. So in that case also, the height of the enema can from the rectum should be 18 inches or 45 centimeter. The same height is required for IV administration also. The IV bottle from the cannula side, the height of the IV bottle from the cannula side, ideal height is 18 inches or 45 centimeter. So we have studied now 18 inches or 45 centimeter is for used for giving colostomy irrigation, administration of enema, and also the IV fluid hanging height also 18 inches. So if you know more same height for any other procedures means, please comment below. It will be informational for other subscribers or other friends also. So we will go to next questions. Which one of the following procedure is used to correct otosclerosis? Which one of the following procedure is used to correct otosclerosis? Myringiotomy, mastoidectomy, stapedectomy, myringiotomy. Here correct answer is stapedectomy. Otosclerosis means auto related to ear. Sclerosis means hardening. In the middle ear, we know three small bones are there. In that, usually the stapes bone will get thickened, or it will get a new bone growth, and the passage of the impulse from the external ear to inner ear will be blocked. So in that case, the surgeon will prefer stapedectomy to remove that extra bone growth or hardening, to make smooth impulse conduction through the middle layer. Myringoplasty means repair of the tympanic membrane. Mastoidectomy means that removal of mastoid or removal of mastoid bone. In the same time, myringiotomy means making a hole in tympanic membrane. So we have studied the stapedectomy is used for correction of otosclerosis. Myringiotomy means it is a repair of the tympanic membrane. Mastoidectomy means removal of mastoid bone, and myringiotomy means making a hole in the tympanic membrane to do some procedures. Next question, the term pyrosis is related to. The term pyrosis is related to heartburn, pus formation, dysphagia, dyspepsia. The pyrosis is related to heartburn. The other name of heartburn, that is pyrosis. Next question, the drugs used to constrict the pupils are. The drugs used to constrict the pupils are Mydriatics, Sulphonamides, Antibiotics, Myotics. The correct answer here, Myotics. Myotics are used to constrict the pupils. Next question, which of the following parts of an eye alters the size of the pupils to regulate the amount of light entering the eye? Which of the following parts of an eye alters size of the pupil to regulate amount of the light entering the eyes? So this is the pupil. So in this question, the name of this part is asked in this question. The blue color part. Options: lens, cornea, iris, retina. Correct answer is the blue color part is iris. The iris will helps to regulate the amount of light entering the light by constricting and dilating the pupil. If more light is required means iris, the pupil will be dilated. The less light is required means the pupil will be constricted. Sixth question, using the rule of 9, estimated burn size in an adult having burn injury to chest and stomach is which percent? 18%, 27%, 36%, 9%. So in an adult having burn injury on the chest and abdomen or stomach. So the patient have how many percentage of burn area, surface body area? Correct answer here, 18%. So this is a rule of 9 adult chart. So in that case, the front part, that is chest and abdomen, is comprised of 18%. Head and face, that is also anterior and posterior, that is also 9%. Each arms 9%, and each leg, that is anterior part is 9%, posterior part is 9%. So one leg is 18%, anterior and posterior. So and last groin area is 1%. So total 100%. Once again, the head, the face and head, that comprises 9%, and each hands comprises 9%. Anterior chest and abdomen 18%, posterior chest and abdomen also 18%. Each leg comprises 18%, because anterior 9%, posterior 9%, and groin area, that is 1%. The size of a burn can be quickly estimated by using the rule of 9. This method divides the body surface area into percentages. The front and back of the head and neck equals to 9% of the body surface area. The front and back of each arm and hand equal to 9% of body surface area. And groin, that is 1%. Next question, which among the following is an example of colloid solution? Which among the following is an example of colloid solution? 0.9% normal saline, Dextran, 0.45% normal saline, 25% dextrose. Here, correct answer is option B, Dextran. Dextran is an example of colloid solution. Colloid solutions are usually used to expand the plasma volume in the case of hypovolemic shock and all, along with crystalloid solutions. So Dextran or colloid solution has some peculiar qualities like it will reduce the pulmonary edema and cerebral edema. So it can safely use for those patients are more prone to pulmonary and cerebral edema. So that is about colloid solutions. It usually given along with the crystalloid solutions. Eighth question, the movement of particles from region of higher concentration to region of lower concentration is called. The movement of particles from region of higher concentration to region of lower concentration is called diffusion, filtration, osmosis, hydrolysis. Correct answer, diffusion. Here in this diffusion, the solute particles move along with the according to its concentration to equalize the concentration part in everywhere in the solution. In the same time, osmosis means it is the movement of solvent particles through a selected semi-permeable membrane to equalize the concentration of the solute particles. Filtration means that is a physical removal of the large solute materials from small solute materials. So filtration means it is a physical separation. Diffusion means it is a movement of solute particles. Osmosis means the movement of solvent particle through a semi-permeable membrane. In acute pancreatitis, the level of which of the following enzymes remain elevated for 7 to 14 days? In acute pancreatitis, the level of which of the following enzymes remain elevated for 7 to 14 days? Urine amylase, serum amylase, serum alkylane phosphatase, serum lipase. Correct answer, serum lipase. Serum lipase is elevated for 7 to 14 days in acute pancreatitis condition. 10th question, which of the following is not a manifestation of interstitial cystitis? Frequency, incontinence, urgency, pelvis pain. Before that, interstitial cystitis means it is a chronic bladder inflammation or irritation. Interstitial cystitis means it is a condition that is caused by inflammation of inflammation or irritation of the bladder wall. That is known as interstitial cystitis. So, which is not a manifestation of interstitial cystitis. Frequency, incontinence, urgency, pelvis pain. Correct answer, incontinence. All other symptoms are usually seen with interstitial cystitis except incontinence. There will be frequency of urination, urgency of urination and pelvic pain. These are the classic symptoms of interstitial cystitis. 11th question, the disease that occurs due to the defect in the genes of one or other parent and is transmitted to the offspring is known as dash disease or disorder. The disease that occurs due to the defect in the genes of one or other parent is transmitted to the offspring is known as dash disease or disorder. Congenital, organic, hereditary, allergic. Correct answer means hereditary disorder or hereditary disease. The disease that occurs due to the defect in the genes of one or other parent is transmitted to the offspring is known as hereditary disease or disorder. Next question. Tonometry is the method of measuring the pressure inside the lungs, pressure inside the ear, intraocular pressure, blood pressure. Tonometry is the method of measuring. Correct answer here. Method of measuring intraocular pressure. This is a tonometer And tonometry is the method of measuring the intraocular pressure. Tonometry is a test to measure the pressure inside the eyes. The test is used to screen for glaucoma. So increased intraocular pressure that leads to glaucoma. So it is used to tonometry is used to screen intraocular pressure. Also, it is used to measure how well the glaucoma treatment is working. So in these two cases, we can commonly use, that is, either we can screen the glaucoma. If it is intraocular pressure is increased, means there is a increased chance for glaucoma, and also we can measure the result or progress of the glaucoma treatment. 13th question. Hemophilia is associated with. Hemophilia is associated with chromosome 11, Y chromosome, X chromosome, chromosome 21. Here, correct answer is option C, that is X chromosome. Hemophilia is an X-linked recessive hereditary disorder that classically affects males due to the presence of only one X chromosomes in the males. Because it is a recessive hereditary disorder, even one X chromosome can cause in males. In the females, same time, X chromosomes are there. Two X chromosomes are affected, then only females will get the disease. Only one X chromosomes is affected in males because XY chromosomes are there. So already one chromosome is there in males. So that chromosome is affected. So the male person can easily get the disease. That is why it is a X-linked recessive hereditary disorder that are classically affects the males. But in some cases, females also affected, but it is a very less chance only. Uh, 14th question. After a renal transplant, the rejection that occurs within a minute is called. After renal transplant, the rejection occurs within minutes is called hyperacute rejections, chronic rejection, subacute rejection, acute rejection. So here the rejection is happening within minutes after transplant. So here the condition is known as hyperacute rejection. Hyperacute rejection that occurs within a minutes to hours. After transplant, within a minutes to hours, that kind of the rejection reaction will start. That kind of rejection is known as hyperacute rejections. If the rejection occurs, that is after some days, that time it is known as acute rejections. A rejection that occurs after some days or after some weeks, it is known as acute rejections. Or if the rejection occurs after months, then it is known as chronic rejections. Hyperacute means it is starting from within a minutes to hours, and acute rejection means it will start hours after the transplant up to some weeks, and chronic rejections means it starts from after several months. Last question. Which of the following drugs is used for dilation of pupils? Which of the following drug is used for the dilation of pupils? Tropicamide, betamethasone, levofloxacin, gentamicin. So we will put some medication to eyes to dilate the pupils. It will help to examine the eyes, inside of the eyes. So we will put some drugs. So the drugs that used to dilate the pupil is known as one of the example that is known as tropicamide. In previous question, we have discussed the drugs used to dilate, constricts the pupil. Here is an example. Tropicamide is an example of the drug used to dilate the pupil. So myotics means to constrict the pupil. Tropicamide is an example of Mydriatics, and myotics is usually used to constrict the pupil. So that is about today's video. Thank you for watching this video. If you have any doubt, means you can ask in comment sections, and please like and share this video, and subscribe our channel, The Nurse. So we will provide more videos regarding NVS, Navodaya Vidyalaya Samiti exam preparation. So please stay tuned. Thank you.